All right, so this is Dylan, and Dylan is coming to us with some complaints of kind of non-specific low back pain that's all off to the side. So as we go through and we start to evaluate, we do our comprehensive spinal evaluation. We note that it's coming more from the thoracolumbar fascia, a little bit of lats, and a little bit of QL. So we can do some of our objective testing just to see range of motion wise where we're actually getting those limitations from. A lot of times with the low back, we could have, when we talk about our fascial lines, we can have deficits either with flexion or rotation. So coming either from our spiral line if we're lacking in rotation, or coming from our superficial back line if we're having limitations in rotation. So we'll bring Dylan through a few different objective tests just to kind of get, some sort of objective data and measurements for that. So the first one that I want Dylan to go through is he'll just come through a thoracic spine rotation, and again we just want to see if it's coming more from rotation, limitations of the lats, or coming more from that flexion component. So we'll do that after. So the first one, go ahead. So with Dylan, as he comes up into that rotation, what I can do is I can put like an inclinometer from my phone, an app, go to like T8, T9, and just assess that range of motion difference. And then we'll go side to side. So we'll go through like a set of 3 on this. And again, you can just take the most neutral measurement and wanting them to get into full rotation each time that they're coming through when you measure it. And then switch sides. Come all the way up. Is that as much as you can come up?
Yeah.
Okay. So we do see more deficits on the right side than on the left side. And again, just arbitrarily, we're not actually evaluating that. The next test we'll have him do is just a shoulder flexion test. And again, we're just looking at that lat range of motion. So lay on your back. And then we'll just start with your arms down here. And then we'll just come straight up into shoulder flexion. And then just get those to relax. So we do note some deficits kind of coming through here where we're not able, with some overpressure, I can get his arms all the way down, and that's right side kind of definitely pokes up a little bit more than that left side. We do see some flailing of the ribs too, so maybe just cueing your patients just to try to keep that low back kind of down onto the table as well. The last test we'll have Dylan do is we'll come up and we'll just have him go through and touch his toes. If he can touch his toes, maybe we look for how far out he can come through. And again, this might be indicative more of a superficial back line. As he's coming through, I'm going to have him stay down here. We want to look at range of motion and the deficits there, but also where is he trying to get his range of motion from? Is he using his hips and kind of pushing them out to get more extensibility through his hamstring? Or is he trying to round out his low back to get more range of motion through here? So we do notice some flexion and rotation, so probably contributions from both spiral and superficial back line.